Hi everybody, I'm Lisa Mitchell and welcome to week 2 of ArtFix. I'm so happy that you're here and I hope that you've been able to take a look at the artist's creative process, because today what we're going to do is learn how the artist's creative process overlays and is absolutely parallel to the therapist process or the therapeutic process. It's a beautiful thing to see and then start to know how you can actually be more creative in your work. First, what I want to talk about though is this idea that we have about becoming more excellent therapists or better at what we do. And I think there's a sort of a common focus, which is for us to learn more and gain more knowledge, all right, and to really hone skills or learn new techniques or protocols, that kind of thing, that we're constantly seeking ways that we can help our clients in more effectively, right? So we go to a conference and we learn a new technique and we come back and we may have to get certified in that technique and we use it and we gain experience in it. And all those things are really, really good. However, there is that idea that by learning new skills, we're trying to overcome that feeling of not being good enough or not or feeling proficient, right? So if you go and you learn new skills, then there's a point in time where you don't feel proficient, but then at some point you say to yourself, okay, I'm proficient, I can really treat this issue, right? Well, if you look at the creative process, really what it's inviting is to stray away from the effort to become proficient, and rather it's inviting people to become okay with not being proficient and actually celebrating the fact that they don't know or they don't have the answer or they don't feel skilled enough, and then to become more creative in that sense and utilize the knowledge and the skills that they already have. Okay, let me say more about that because that's kind of a strong statement. It'd be the parallel of an artist, say, going to learn new techniques, say, right? And going to study with a certain artist who's going to teach them, say, a dry brush technique, right? And they could go and they could perfect that skill and they could bring it back and they could do it over and over again, right? And feel really good about that, like they have that in their toolbox, okay? And in order for them to truly be creative and genius in their work, they're going to have to bring that skill back and apply it to what they already know and how they already create, how they already paint, right? They're going to work it in. What that's going to require is a jumbling up, an experience of not being certain, a little bit of a rockiness, right? That doesn't have them feeling proficient, but through their lens has them feeling highly creative, okay, and better at what they do, right? So really it's a paradigm shift, and it's very, very hard to do it unless you have the map and the understanding behind it. But the paradigm shift is this: the more that you don't know, the more that you're certain that not knowing is the way to go, the more effective you actually are. Okay? Back to Scott Miller and the super shrinks, right? And so when we're talking about the therapeutic process, we're really talking about having a map that will help us integrate the skills that we already have and approach them and clients in a totally new way, right? And not getting stuck in places where we don't know, okay? So what I want to do is walk you through the whole process, and you can get to see where there are total invitations, total stuck points, where you might feel like you're going against the therapist error-phobic culture and needing to embrace the artist culture in order to feel more creative and be in that creative process with clients.